You sit at a desk all day. You train a few times a week, but your hips, hamstrings, and lower back still feel ancient. They feel like they belong to someone twice your age. Here is the permanent fix to unlock your stiff body.
You've been stretching, probably for years, and your hips are still tight. Your lower back still locks up daily.
Your hamstrings pull whenever you try to do something athletic. Years of stretching, but you still can't move properly.
It is time to actually fix it. Flexibility is passive. It's how far your joint moves when something else pushes it.
Mobility is active. It's how far you can move a joint, yourself, under your own control. Make sure to subscribe. Most people only train the passive one. You sit on the floor after a workout, count to 30, and tell yourself you did something.
Your joints get pulled into ranges they can't actually control. That gap is where serious injuries happen.
Your joints need mechanical input to stay healthy. You need active, controlled movement through your full range of motion. Sitting at a desk for 8 hours causes tissue breakdown on a cellular level. Your body doesn't care that you were busy.
Train your joints to actually control that range, not just sit in it. Here are 5 simple moves for your hips and lower back.
Move 1. Downward dog to deep lunge. 1 minute each side. Start in downward dog, pressing your hips back.
Drive 1 foot forward into a deep lunge. Hold, then push back. This actively loads the hip flexor at its end range.
Don't just sit in a passive stretch waiting for something to happen. Active load is what builds real, lasting joint control.
Move 2. Kneeling Cossack squat to hamstring stretch. 1 minute each side. Keep a wide stance and drop 1 knee down. Shift your weight laterally. Most routines only work forward and back, but your hips move in many different directions. Nobody trains this direction of hip mobility. Now you will. It is the secret to unlocking tight, stiff hamstrings. Move 3. Move 3. Glute bridge with rotation. 1 minute each side. Start with a standard glute bridge, lifting your hips high. Rotate the knee out at the top of the bridge. This targets hip extension and thoracic rotation in one fluid movement.
Most lower back stiffness starts in your thoracic spine. When it stops rotating, your lower back takes the blame.
Rotate your hip while keeping the other leg extended. This increases your range of motion and loads the joint heavily.
Move 4. Seated hip internal rotations. Number 1. 1 minute each side. Sit on the floor with your knees bent.
Keep your feet flat. Rotate both knees to one side. This is crucial for improving hip internal rotation. Internal rotation is the most neglected direction of hip movement. If your hips feel tight despite stretching, this is why.
Move 5. Seated hip internal rotations. Number 2. 1 minute each side. Keep the same position but extend one leg out.
This is much harder than it looks. It builds active strength and control right at your absolute end range of motion. That is the complete routine. Just 10 minutes a day. 10 minutes daily is far better than 70 minutes once a week.